refreshment? Yes? Yes? You are ready? I can see some of our colleagues from the substitutive dental sciences. They did not take their influx. Does this mean they have low attendance? Just 3. And from the female section? The substitutive dental sciences? So, but there are many still remain. Yes, this is the substitutive. If there is anyone did not take from the prosthodontic department? Anyhow, now we are going to start our objective for today. All what has been left is just an introduction. Yes, but first we have to explain. What is the item writing flows? Writing flows means efficiency. Here in this article, they found that in reviewed 5 medical school tests, and they found up to 46% of their questions are flawed, are deficient, defective. And 10 up to 25% of candidates classified as failed, those who failed the exam, would have passed if the flaws were removed and the exam result was recalculated. 25% of your students who failed the exam might succeed if you remove the flaws. And here they analyzed 10 summative tests for the impact of item writing flaws on student achievement. They found 47% of the items of the question, almost half of the exam, are flawed. And the high achieving students, the high level students, were more likely than borderline students to be penalized by the flawed items. You are not just failing students who do not deserve to fail, but also you are reducing the grade of the high achieving students by these flaws. Do you like this? The MCQ written at lower cognitive level were significantly more likely to contain item writing flaws. When the question construction is made with an objective or with a result to assess low cognitive or pure knowledge, it's more likely to contain flaws. Teacher-generated questions. If you make your own question, homemade question, were more likely to be written at higher cognitive levels when compared to internet resource or exam books. If you are doing your own questions, they will be more likely, there will be high tendency for these questions to measure higher cognitive skills. Study results revealed that most items contained flaws and were written at the knowledge or comprehension level. Most of the questions are written to assess the knowledge factors. Few items have linked objects. This is very important point. Linked objects. When you construct an MCQ, you will find when during the small group activity, we extracted some of our question bank. Questions that were excluded from the exam because of their validity or for other reasons. Now when you look at many of these questions, you may, although you are university professor above the average graduate level, even if it's not your specialty, you realize that you cannot determine where is the objective of that question. Is it in the stem or in the option? We agree that for the MCQ there is a stem, a phrase, a sentence, problem presentation, and there are options. Some of the questions that you are going to assess now, you will feel, although you are postgraduate, you are university professor, you will feel that you cannot locate where is the objective. Is it in the stem or in the option? When you construct an MCQ, please have a clear objective for that MCQ in your mind. Last year, I remember we discussed about the study plan. For every lecture, in the first slide, you include, by the end of this lecture, the student should be able to. These are the intended learning outcomes of that lecture. Yes? Yes? Yes. So when you construct questions, you should target these objectives, because this is the objective of the exam. The lecture objectives serve the course objectives. Yes? The lecture objectives serve the course objectives. And the course objectives serve the curriculum objectives. So, when you assess the students, please link your question to a clear intended learning outcome. Keep it in your mind while you are constructing your item. Otherwise, it will be unfocused. And if you will feel confused when you are looking at the questions now, what about the students, which is far beyond your level? Few items had linked objectives, and no association was found between the presence of objectives and flows. There is no relation between the linked objectives and the flows, but this is one of the flows. There is no clear objective for your item. This study summarizes what we are looking for. Number one, adherence to an in-house style. In-house means college, university, country, regulation. I explained at the beginning that our graduates who are in the internship now, they are going to take an exam, to take the license from the Saudi Commission for Health Specialty. And they set their regulations. Item flows, you will find different schools. Some they consider 14 items, 14 flows. Others will consider 21. But for the Saudi Commission for Health Specialty, they consider 19 items as flows. 19 defects. I am not saying that what they are doing is the ideal. But our graduates, our product will be assessed according to these rules. So you have to prepare your graduates ahead to take the exam and to pass that exam. Otherwise, if you are graduating students who will fail to get the license, it will be a disaster. Item proportion testing at K2 level. According to the Saudi Commission regulations, they prefer the K2 type question. The higher the questions that assess or evaluate higher cognitive skills. Questions should be from a sort of more problem-based questions. The knowledge in their regulations are limited to 25%. The basic knowledge, the information recall, the definition of oral pathology. If this is some sort of just information recall. So they are not totally excluded, but this is limited to 25%. But still not at that way, not to give it as definition. Functioning distractor, implausible distractors are not allowed. You understand what is meant by implausible distractor? What's the implausible distractor? For 25 years old male patients presented to your clinic with occlusal tears in tooth number 46. Which of the following, or I will not phrase it into a question, or the most appropriate restoration for that patient is an amalgam, glass ionomer, composite, alginate. Do you think now you realize that there is grammatical clue? Yes, but I am talking about other things. I included in the 4 options alginate. Alginate, it's not filling material. So, it's meaningless to include it in the option. It's implausible. It's not distracting. Non-functioning distracting. You are talking about something which is not related to the question. The overall discrimination issue. I was discussing with Dr. Amin now. I think there is some misunderstanding. When we talk about the high achieving students and the low achieving students, we are talking about the upper third and the lower third. What about the 40 in between? When we assess the discrimination, we are comparing the upper third and the lower third. The upper 30% to the lower 30%. So don't think when I say the good discrimination 0.5 means 50% of the total number of students. No, this is the result based on subtraction of the lower level from the upper level. Is it clear? 30% higher level, 30% 5% lower level, still there is average. These are not included in our equation to calculate the discrimination. To assess the discrimination for a question, we are comparing the higher level students with the lower level students. By K2. K1, this is to assess the knowledge. K2, this is to assess higher cognitive skills, interpretation, differentiation, problem-based question. This is nomenclature. They get K1, knowledge 1, knowledge 2, this is the higher level of knowledge. K1, this is the basic level of knowledge. Basically what we are talking about now is the K1 and the K2. The lower level of knowledge, which is just information recall. The higher level of knowledge, which include reasoning, differentiation, discrimination, interpretation, and problem in a problem-based way. I'm talking about the question type. Now what you are talking about is the question type. The item writing flow frequency. All of these items you should consider. So now it's time to speak about the item writing flow regulations set by the Saudi Commission for Health Specialists. This is the A-type question that we are all constructing for our exam. Each question should be constructed to be composed of 3 main components. Still, that include the information, the scenario, this is usually the longest part. And the lead-in, this should be in a separate line. So now you give the scenario, you give the information, and in a separate line, give the lead-in, starting with a question word, ending with question mark. This should be the rule for 95% of your question. 5% is allowed to end with, to be completed from the option. Clear? Number 1, there is a string that contains the scenario. And this string may contain, this is the longest part, should be. And this string might contain a photograph, or a radiograph, or a histopathology, or diagram, or it may contain laboratory result, complete blood picture of a patient, for example. This is the longest part. This is called the stem. After you finish the stem, full stop and start from a new line to write the lead-in. The lead-in should start with a question mark. This lead-in determined by the objective you are going to assess. The lead-in is targeting the objective or the intended learning outcome that you are willing to assess. Should start with a question word, end with a question mark in 95% of the cases. In 5%, this lead-in may be not in the question form, but in the form of incomplete sentence to be completed from the option. This should be restricted to 5% of your submitted question. This is clear? we have to stuck to the format of the A-type question. STEM followed by lead-in, and the answer of this lead-in are in the options. The options that we are following in the college and in the Saudi Commission as well are 4 options. 1 correct answer and 3 distractions. Until the last year, you remember that we were requesting 5 options. 1 correct answer and 4 distractions. We did not delete, or we did not shift from 5 options to 4 options from our mind. Based on statistics that kindly conducted by the exam committee, Mr. Mahmoud, thanks to him and to his group team, they analyzed the question, and they found that 70% of the question, the 5th option, the number of students, 96%. The number of students answering the 5th option is 0. 0. That means the 5th option is not a distraction. That's why, based on this study, we omitted and we shifted from 5 options to 4 options.
Is there a rule for allocating the correct answer within the options? I mean, is there a rule to put to distribute the answers like number 1, number 2, number 3, number 4? Or because what happened is, if we have a rule, what happened in question 5 would not happen. So is there something definite for distributing the correct answer within the spectrum?
If I understood correctly, that it doesn't mean that the 5th option is option number 5, but there is one of the 5 options was not answered by any student, so it's not a good distraction. The rule is that you make the correct option alternating between the 4, not to be fixed or to be in an ordinary form, number A and then number 2, B, and so on. No, this is not correct. The rule is that they should be distributed randomly. Randomly. Just distributed randomly. If there is a reference for this, I am talking now. Today we are talking by reference. Yes. So what I know is that it should be the correct answer should be randomly distributed among the 4 options. Now this is the construction for the MCQ. The MCQ format, the longest part is related to the STEM, the case scenario, and then question line, which is the lead-in question, in a separate line. Don't mix the STEM with the lead-in. The lead-in should be in a separate line. You might think that this is unnecessary. I will construct a question, but not necessarily to be in a separate line. your objective more clear for your students. Now, after reading the scenario, you are giving him the lead-in. And then the option, key, correct answer, and distract. Now this is an example. This is radiograph. Now this is the radiograph. Yes, are you following? Yes. 18 years old patient reports to the dental office for routine dental checkup. Look at the X-ray. This is the step. So now the student, you give him a basic information about the case, and the student should interpret the radiograph to answer that question. What's the best clinical diagnosis? What is the best clinical diagnosis? So the student should interpret the clinical data you get in the STEM with the radiograph to come to a conclusion to select the right option. This is clear? The second point is when you construct the STEM, the lead-in and the options, there is regulation for the word count. The STEM should be as short as possible, with no unnecessary information. I was just discussing a question that a 50 years old male patient or female patient, she came with the orbit flowing in the nose and the tongue is protruding and tooth number 46 is fractured. What is the best prosthetic applying for that patient? So, what is the rule of the falling down of the orbit and the tongue protrusion to the objective? This is unnecessary information. It's unclear STEM. You should not make your student confused. Give him the information that will help him to answer the lead-in. The STEM, the word per item for the STEM, if it's a complex STEM case scenario, it should not reach 100 words per item. The maximum is 100 words per item. This is for the complex. For the simple STEM, there is no case scenario. Not more than 70 words per item. Option plus the lead-in question around 33 words per item. That makes total for the question 150 words per item. STEM, lead-in, option, the total word count should not exceed 150 words if it's a very complex case scenario. If you are following this rule, now we can say that the ideal time to answer an MCQ is 50 seconds for one question. This is the international standard. If you are stuck to this rule, unfortunately we are not. And the students feel confused. That's why we are giving our students 2 minutes per item. But if we are stuck to this, one question, maximum 1 minute. Four options, 3 distractors and 1 correct key. One best answer. It's not the one best answer in the whole world. No. It's the best answer among the options you are giving. You are giving 4 options, and this one is the best among the 4. Not necessarily to be the best in the world. All 3 distractors should be correct statements. Don't make a distractor that say the composite or the porcelain, the black color porcelain. This is incorrect sentence. So this is not a distractor. So every distractor should be correct in its own and should be functioning distractor, not implausible distractor. Clear? Clear? Every statement should be correct in its own, but not necessarily to understand the These are the rules. Yes. The option sequence. When you put your option, it should be in a sequence, either ascending or descending. For example, if we are talking about a patient with Behçet's disease, for example, the patient with hyperparathyroidism, the hormonal level will be, for example, 10, 25, 5, 100. This is not correct sequence. You should not trick your student. You want to assess if your student knows the information, put it into a sequence. If this is important. So 1 or 5, 10, 25, 100. Make it in a sequence. Yes. No. Now you are going to prescribe antibiotic for a child, for example, it's 10 years old, the child, and you are going to prescribe antibiotic for him. The optimal dose for that patient is 25 milligrams per kilogram body weight, 50 milligrams per kilogram body weight, 100, 500. This is the sequence, what we need. Yes, but the sentence is correct. For the adult, for example, the adult, the dose per kilogram body weight might vary, or according to the condition. Like this, but not to be unlogical. Yes.
Sorry, going back to the unnecessary work and from the teacher point of view, there is some word as a benefit for him, only for him. For example, for me as a text orthodontist,
information serves the objective, so it's important. If the information serves the objective and will make that student can make use of that information to answer the lead-in, so it's valid. Otherwise, if the student will not make use of that information in the sim to answer the lead-in, so it's unnecessary information. This is clear? 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 Not clear. Clear in the right side? The left side. The last point is that when I submitted the questions to the Saudi Commission for this licensing exam, who knows the aneurysmal bone system? The aneurysmal bone system. The aneurysmal bone. The aneurysmal bone system is a fit where there is high vascularity, and it's characterized clinically when the surgeon opens the cyst, there is a welling of blood. يعني كانوا الدكاترة بيقولوا our doctors, and even we describe it to our students as this is نافورة الدم. I wrote in the stem that the surgeon described welling of blood on opening the lesion. Whenever you, with any textbook you are going to open, you will find this expression, welling of blood. But the reviewer in the Saudi Commission, they refused. They said this is too scientific term. The important to assess in your student is not to know or not to know the welling of blood, but he should know that there is extensive bleeding. On opening the lesion, there was an extensive bleeding. So, make your language as simple as possible. So, if your student is not that excellent in the comprehension, he still can answer that question correctly. If you can replace it, if it's doable, yes, if it's doable to replace that word with another word that gives the same meaning in a more simple language, do it. Yes, if it's scientific, and this is, you are willing to assess. If you are willing to assess that piece of knowledge, this scientific term. But if it's just a servant for the lead-in, so make it in a simple language. So the objective of your item is the determinant of how to construct your question. Example. Now look at that thing. Which of the following factors contribute to this lesion? C. Clinical images A and B having high recurrence rate. Okay? So this system includes photograph, includes radiograph, plus basic information that are necessary to answer the lead-in. This is another example. 23 years old man A together with his 33 years old elder brother. radiographs. And the important here is that they are two brothers. That indicates hereditary. So this is important information to answer the question. So there is a case description and there is a radiograph. These constitute the stem. And this is a case description with laboratory results. These constitute the stem. The total is 150. Yes, this is 100 items for the stem. This is another example where there is a chart and the case history for the stem. This is as you can see that I just make a copy from the exam. Yes, it should be above. Yes. Now, this is the stem. The number of words is 27. What test would give the same answer? This is what it's called the lead-in. And these are the options. Here, these are another two examples. The lead-in should start with a question word and end with a question mark. As I told you that the correct option should be the best single correct answer. Why? Why we are ruling the K-type question? This is the point of Dr. K-type question means that, may I use your example? No, I will use your example. The application presented to you with open mark. Here is the application of fluoride for the period, reconstruction of the crown, or version of the crown portion. And then the student should select between A and C, B and C, C and D, and these answers. Yes, you get the scenario, and after reading that scenario, please answer the following two questions, number 1 and number 2. So, for every question, it should target one clear objective. Don't make your student confused, or don't disrupt him between two objectives. Now you are, the students may feel confused. So should I remove the class or manage the crowd? Make your target one for the question and make two questions from the same scenario. Is it clear? Huh? Okay. No, you are going to get two questions on the same scenario. After reading that scenario, please answer the following question. What is the same question, avoid asking the question for which there is only one correct answer. Then it will be a sort of transport. زي ما احنا شفنا. The language of the question. The level of reading difficulty should be kept low. As I give you the example of the weight of blood. I am not accepting the student's knowledge of blood weight. This is an information I am getting the student to lead him to answer the objective of diagnosing or managing this lesion. So make it in a simple language. This is great. If you are asking, and this is your objective I might say that my language is there. And the word I use is very there. And objectives are there. If I ask to donate with me at the same time, we might not be that you yourself. If I do not say that, you might not some so give up your gift we want to take care of you. Our newspapers are and if they are not, they will not stay. What does truth mean? When the correct answer to the question is attempted or provided by truth and construction to future iniquity or anything in language, in construction, the whole unclear, unproven, or whatever the questions I get contain truth. I want to talk to the international figures. We have to dedicate moving forward.
I think about all of us. Automatically, in this case, you exclude two questions. Just student when answer for two questions, so the answer is the remaining question. The opposite side, none of us, for example, when you say in which city you can perform Umrah, for example, let's say Riyadh, Qasim, Gulf, and Jeddah. Any student can say yes. Any student can confirm there is no place of this city, then you can perform Umrah within it. But you cannot say when you can perform Umrah. You cannot say Makkah. Makkah is the answer which the student cannot answer. Okay. So you must extract the answer from the student, not for giving explanation. Is it clear? So now, let's say the question with four options. I'm going to repeat the question with four options. The student can know that the parent is correct, the person is correct. There is no need to read the code. There is no need to read the code. If there is two options correct, even if the parent is correct or not correct, it is sure that these two are correct. So the answer is Allah. So you are not accepting one option. The two correct options, the answer is Allah. So let's see the five options. And there are two correct answers. So the answer is Allah. In the second option. And there are two correct options. So the answer is not the correct. The second is Allah. It's none of the above. You are not accepting the necessary outcome. This is the example to Torah having is the student, you are intending the outcome is to know that the alternative amalgam is better than the alternative which is not. Your objective, your intended outcome is to know where to answer. So if I am given the four options that was practiced, Medina, Jeddah, Riyadh, second. So you ruled out one of these, but that doesn't mean that your student knows where to do Umrah.
When you get the question, trying to item, you should try to record. That item, when we submit the question to the Saudi Commission, you should write the record. Name, edition, chapter, page, line, from line 46 to 46. So, that's your question. One correct or cleanly better. Examine your students based on your notes. Because that is just a research. So, take that your students to a place, regardless of your personal conception. No relation. No relation. I'm talking about no religion while when you are taking your exam. Don't target one group of your students because of their religion, because of their ethnicity, because of their political thought. يعني أنا مثلا رمعاوي مش عارف كده أنا متارجت واحد لا ولكن religion ethnicity أو but the idea you should take it out. Be careful. Okay? Yes. I am telling not to target one ethnic group. Don't make your exam, for example, when you make a question on the Pentagon. You are asking about the ethnic group at which the Pentagon is prevalent. It's the Ashkenaz. And I go to another topic to bring another item targeting the Jewish. And the third topic is the same. So, you are fine. Leave your thought outside the exam. You are assessing intended learning outcomes. You are assessing objectives. You are not assessing beliefs. That's why I am saying what Allah said, اعدلوا هو أقرب للتقوى. Don't make your question sick. Make it simple, clear. Because your objective is not to assess the student's capability to understand English. Your setting the ideal. So grammar, logical, sometimes you may exaggerate, but it will do, because this might mislead your skill. As an example, I was just giving that 40 years old female patient presented to the dental clinic with eyeball dropping in the mouth and tongue protruded and with fractured lower molar. What's the best restoration? What is the benefit of this story about avoid money response? The student, while taking the exam, while taking the exam, are understood. We are not ready to see any joke like the exam. Items should be straightforward. They should clearly be like those that no material controls do not focus on object. Make sure every item has a value and that it's contributing to the final score. Balance in one item is serving your course object. If every item in your exam has clear objective, so it will serve the course object. Let's get that. 23 years old man with occlusal caries, tooth number 42. The most appropriate restoration is to use hand. Rather than tube, then a brush here, numerical question. Osteoporosis is disease with increased incidence in postmenopausal women, which is usually associated with increased incidence of tooth mobility. What's the most expensive age of female patients who have mobility? 42 years. The benefit is and it is numerical tube. Postmenopausal, again, it's not disease. It's not only birth. It's not that year. So that is numerical tube. In your stem, logical, grammatical, or numerical tube. So shifting recall to reasoning question. This is from the Bloom taxonomy. The student, what to assess is to know and not have, and this is what we are assessing in the written exam. Short have, this is psychomotor. That's not included in our exam. And 2, this is psychomotor. So this is the 2 levels of knowledge, K1 and the K2. And this is behavior, psychomotor, interpersonal communication. This is the professional group. This is probably from the deanship, the dental college, dean committee meeting, where they agreed on considering these K1 and K2 for the licensing exam that will be held by the Saudi Commission from 2015. And that is the distribution announced by the Saudi Commission for Health Specialties. You may look at your specialty to see the power or the percentage of questions targeting your division. Oral application there is clinical density that you can add to all other clinical specialties. Is it okay? No problem. Clinical density. Oral application not report. I will just explain that the more K1 question, the more fluid will exist in your item. Plus, application usually requires knowledge, but to know is not just to report it. Doctors do things. So that's how to do it. Your questions are on the web. Easy memorize. So you have to construct your question. Application question more difficult to memorize. There is a scenario that is more difficult to memorize when you compare it to basic knowledge. Definition of disadvantage of advantage of simple equal or easy or easier to memorize. Application tends to remove truths as we discussed. That the more K1 question, the more truth. Several items from one scenario. You can take one scenario with the more K1 examining the more K objectives for the same scenario. Image are worth 1,000 words. I remember this case for Samia Darwish. She was instructing me during my master, and she said it was pictures saying more than 1,000. So, get your student a check to interpret it. Take him to real life when he is in the exam. Last year, Dr. Mahmoud is here. Last year, we ordered laser printer, it's colored printer for this vessel. Report. This is a simple report question. Yes. Do you agree? So you have to reconsider your OSCE exam. Report. This is a simple report question. Do you agree? Which is the enzymatic method of choice to determine glucose level over a large range of concentration? This is the same question. Whole blood sample, plasma glucose is consumed by red blood cells followed by glycolysis as insulin is not required for its uptake. How can this be driven? It's the same question, but you rephrase it to change from simple recall to data. Which is the universal donor group and type? This is simple recall. You are a doctor on an Arctic expedition. Everyone is blood groups and type so that disaster, the right action can be taken. Explorer 7 means that patient blood transfusion and he is ABRH positive. The doctor means the best strategy. So what would be the best donor strategy? is simply equal to reasoning. Problem solving should be subjective. Just find all or partial things. Minimize guessing. كل ما نروح ناحية problem solving it minimize the guessing. Because the student can already interpret, discriminate, differentiate. So he is using multiple information to come to a conclusion. So there is limited space for guessing. But if it is basic knowledge, guessing is more easy to construct. If we are well trained, it's easy to construct a case scenario because this is from our clinical life. Measure many objectives. Case scenario, it may measure many objectives. That's why we are saying make one scenario with multiple questions, multiple items. Low tech, greater reliability requires lots of time to gain. Subjective. This is an example, low level. This is high level. This is mental example. 23 years old man, A and B, together with his 33 years old older brother. What is the most serious complication? This is very good question. But the case scenario, we didn't make use of that. It is the same case, but we changed the reason. Can you realize the difference? It's the same case, the same thing. We changed the reason. So it becomes more higher confidence. This is another case. What's the most likely direction? It's simple. Very low case of question. It is the same question, but we have something that makes the student interpret and come to a conclusion. You have any question?